Welcome, welcome. All right. Maybe we'll have some other folks join us as we go, but we will go ahead and get started since all of you lovely folks are in the room already. Thank you so much for joining us today for part 2 of our Workforce Professional Development series. Today's presentation is entitled Taking Care, Employee Wellbeing as an Organizational Strategy. So looking forward to getting into it and exploring some of this well-being stuff with all of you. Just a couple quick housekeeping notes as we get started. Today's session is being recorded so that you are aware. The recording and the slides will both be provided to everyone who has registered. They will also be posted on our website, so you will absolutely have access to everything that we go through here today. Really encourage you all to use the chat box as we move along today. Ask me questions, share your comments, ideas, thoughts. We have so much to learn from one another and really want to make sure that our hour together here today is really valuable for all of you. So please don't hesitate. I always like to say the only silly questions are the ones that go unasked. So if you're thinking about something, chances are somebody else probably is too. So please don't hesitate. We'd love to hear from you in the chat. If you are experiencing any technical difficulties, you can send a direct Zoom message to my lovely colleague Mariah Blake, who's on the line. She'd be more than happy to help you. And if you can't reach her via Zoom, you're welcome to shoot her an email as well. Her email is mblake@clinicians.org. Lastly, at the end of today's session, you will see an evaluation pop up on your screen. We really appreciate it if you take just 30 seconds to fill that out. It is part of our funding requirements to capture that information, and it helps us to make sure that our programming is really what you all are needing. And I see a question in the chat about slides from the first session. So if you joined us for the first session just a couple weeks ago, all of the slides from the entire series will be made available to all registrants. So no fears, we will get you everything that you need. All right. We are here today on behalf of ACU, or the Association of Clinicians for the Underserved. ACU was started almost 30 years ago now by alumni of the National Health Service Corps, and really everything we do at ACU strives to advance the workforce at community health centers. So we have a lot of wonderful programming going on, access to care and clinician support, resources around recruitment and retention, the National Health Service Corps, resources, training, networking, lots of really wonderful programs. So when you have a moment, please feel free to pay us a visit at clinicians.org, and you can see all of the other great things that ACU is up to. We are here today specifically on behalf of the STAR Center. STAR Center sits beneath the ACU umbrella. It stands for Solutions, Training, and Assistance for Recruitment and Retention. And we at the STAR Center are funded through a national cooperative agreement that we were first awarded in 2014. So this is actually our 12th project year. We are funded generously by the Bureau of Primary Healthcare, BIPIC, and the Health Resources Services Administration, or HRSA. And we are one of 22 organizations that are all part of this cooperative agreement, and we are all National Training and Technical Assistance Partners, or NTAPs. And the beauty of this program, one of the many benefits, is that all of our resources, all of our training, technical assistance services, webinars such as what you're here for today, are all available free for you to access to support your work at your health centers. So after today's call, when you have some time, really would encourage you to visit our website. It is separate from the ACU website. You can find us at chcworkforce.org. And there you will find all things STAR Center. We have archives of all kinds of webinars, trainings, fact sheets, e-learning courses, audio trainings, you name it, we've got it. And if there's something you're looking for that you're not finding, you can always reach out to us directly at info@chcworkforce.org. That goes to a real person, I promise. It comes right to me, and we're happy to direct you to the right place from there. So please don't hesitate to reach out. So that's who we are. This is quite literally who we are. This is the lovely STAR Center team. My name is Sydney Axelrod. I'm going to be presenting the webinar today. I am the Associate Director of Workforce Development on the lovely STAR Center team. And as you can see, all of our individual emails are all listed here as well. We'd love to hear from you. So if you have any questions, feedback, needing some support, whatever it may be, please feel free to reach out to any of us. All right. If you've been to any STAR Center trainings before, I am sure you have seen this slide. This is at the heart of everything we believe at the STAR Center, that workforce is the fuel. We say it all the time. If you had no workforce, you would have no health center. And so when we're taking this metaphor of the workforce really being the fuel of your health center, when we think about a health center with a full tank, it's really one that identifies workforce as an essential organizational issue, right? Not an afterthought, an essential organizational issue, and as such is investing in the appropriate operational and staffing resources to support that workforce. And when we think about a health center with a full tank, we really think about it as having some key features and key areas of investment that we're paying attention to at our health centers. And here they are. These are the core components of a highly functioning health center. And as you can see, there is quite a lot that goes into it, right? And these, I'm sure there are many other things, but most can kind of fit within one or two of these buckets, right? We think about a full tank organization as one that has a data-informed workforce plan. Again, really centering and prioritizing that strategic investment in workforce as opposed to just, hiring and retaining ad hoc and in a response to organizational needs, but really centering it as a priority. And part of that retention strategy is, of course, effective compensation structures, as well as organizational norms that are focused on engagement, tested recruitment and retention strategies. Sometimes you got to throw some spaghetti at the wall, and other times there are tried and true things that we can implement. Health professions training programs, the existence of a chief workforce officer, high functioning managers and investing in those managers with the supports that they need to be high functioning, and lastly, policies and procedures that support the health center's mission and values. And so today's presentation, we're really going to be focusing on this idea of employee well-being and how we can think about well-being as a key part of our retention strategies. And so when we look at well-being, we're really touching on several of these core components, right? A well-being plan is part of a data-informed workforce plan. We'll talk a little bit about that. Effective compensation is a component of well-being, as well as your organizational norms. When we're talking about those tested retention strategies, we can think about well-being as being a key component of that as well. And all the rest of these, it really touches a lot of these different things, which is why we wanted to make sure, as we're thinking in this 3-part series about how we can strategically invest and plan for retention of our workforces, really well-being emerged as such a key and central concept that is worth taking an hour out of our days to think a little bit more strategically about. So you might have heard me say this, and you probably hear us talk about it a lot at the STAR Center, but we are big proponents of a comprehensive workforce plan. And beyond our preferences, it is something that HRSA is requiring of most health centers, and they really want to see this, right? And so when we think about a comprehensive workforce plan, oftentimes it can feel a bit nebulous, a bit intimidating, right? To have an entire comprehensive strategy all written down in one place. What I'd like to remind you all is that there is a good chance that you have a lot of this already. These things are already happening within your organization. Somebody has already written it down somewhere, or if not, it lives, in real clarity in their mind, right? And so the work to really put it all down on paper and compile it in one central place is not as big of a job potentially as you might think that it is, right? And even if it is sort of a lift to get this all together, number one, you do not need to do it all in one sitting, right? You can kind of work on it over time. And number two, you really encourage you to think about this as an investment in the future of your workforce, right? So the time that you may be investing now in putting together a comprehensive workforce plan is going to be given back to you tenfold months down the road when you run into an issue and already have a protocol written down in your workforce plan, right? And this is a nice little infographic here that kind of just lays out for you all of the different components when we're talking about a comprehensive workforce plan. We are talking about your organization's vision for the services that you are going to provide in your community, really doing an assessment of what you're already doing, what's working well, what's not working well, what do we already have written down, what do we not have policies around, right? Really thinking explicitly about a retention strategy and a recruitment strategy, right? There's a reason that we talk about retention before recruitment. And that's because having a wonderful place to work that people do not want to leave is actually your number one tool for recruiting amazing new candidates into your organization, right? And it's not just like we're gonna like make it up and try things and cross our fingers and hope that people want to stay and work here, right? We're really talking about being intentional about a strategy around retention. How are we going to attract and hire the best possible candidates from our communities for these positions? And then how are we going to think strategically about keeping them within our workforce, right? Your development strategy is a part of your comprehensive workforce plan as well. And part of that long-term development strategy is also thinking about a health professions and education and training program, right? And so that's where that HPET kind of fits in under that bubble. And then lastly, thinking about action planning, right? So as you can see, there's a lot of different components here. And I think as we get into today's content around workforce well-being, really it falls most squarely under this idea of a retention strategy, right? How can we be really proactive and thoughtful and intentional about creating organizational cultures, organizational policies, procedures, and norms that support a really, really strong culture of retention at our organizations. Now, one key component to doing that, and as we're thinking about retention and recruitment and all of these other organizational considerations, is really to think about the role of leadership. There's a real role for leadership to play here, especially as we're thinking about the quality of experience our employees have when they come into work every day, right? And so, what we really encourage is that your leadership really needs to reflect your organization's values. And not just in what they say, but also in how they say it and what they do, right? In their day-to-day actions, right? And so I'll give you a simple example of this, right? I'm sure a lot of you can relate to this experience of working somewhere where someone in a leadership role says, "My door is always open." Right? We hear that all the time. It's kind of like a vague platitude. My door is always open, right? And that might sound really great. And you might think you're signaling something about your values of transparency and accessibility to your staff and positive communication, right? But what's even more important than you saying that is what does that look like in your day-to-day actions, right? If your calendar, as that person in leadership, is booked solid from 8 a.m. to 6 p.m. every single day, and folks who have visibility into your calendar don't see any openings to talk to you, right? Or if they walk by your door and it is literally physically closed every single time and you are head down, in your laptop, that's not reflecting the same thing that your verbal messaging is, right? And so what does that really mean? My door is always open, right? And so in this example, what we would encourage you to do is think about how we can create spaces and systems and norms that actually support what we're saying, right? So if I say my door is always open, maybe what I really mean is I am open to hearing your feedback. And here are two available channels for you to submit your feedback at any time, right? Maybe that's a suggestion box in the break room, and maybe that's on an annual employee engagement survey, right? And that's just one example. But this is what we mean when we talk about leadership reflecting the organization's values, not just in what they say, but really modeled in how they show up at work and their day-to-day actions. What's really, really critical is that your health center's mission and is in alignment with the beliefs and values of your workforce, right? That mission alignment between your workforce and your organization is so, so critical to ensuring that we have as much retention as possible and that we have as much employee engagement as possible, and that our employees are really having a meaningful, valuable experience at work, because that is what's going to keep them coming back day after day. So I'm saying a lot about employee well-being. Why does it really matter, right? And I want you all to think about this for a moment. Think about your own experience in your workplaces, right? And the role that well-being has had on your experiences as an employee, right? Spoiler alert, it really matters. It matters a lot, right? And oftentimes it's going to be the difference between having a high turnover rate or having a high retention rate, right? Is how much well-being do your employees experience at work? This is not a unique challenge, right? This kind of nut to crack around employee well-being. This is something that is affecting the workforce nationally and globally, and especially the medical and healthcare workforce, right? And so these statistics come from a survey that was conducted in 2020 by Mental Health America. And it found, found that of all health workers that were surveyed, 75% of them felt overwhelmed. 3/4 of the workforce felt overwhelmed. 76% reported exhaustion and burnout. 82% reported feeling emotionally exhausted. 86% experienced anxiety, and 93% experienced stress, right? So these numbers are very, very telling, right? There is something to pay attention to here, that between 75 and almost 100% of our staff is experiencing stress and overwhelm and anxiety and emotional exhaustion and burnout, right? And so what do we think is going to happen if we see rates this high, right? People are going to leave, right? They're not going to stay and continue to work in a job where they experience stress nonstop with no reprieve and no light at the end of the tunnel, right? So this is a really big problem. It affects the entire healthcare workforce. And it's something that we all have something within our power to do something about. So we talk a lot about this idea of burnout, right? We look at these statistics, and 76% report exhaustion and burnout. What do we really mean when we're talking about burnout? Burnout is, I think this is a controversial one for some people, but it shouldn't be. Burnout is an occupational phenomenon, right? It's not necessarily a medical condition, but it is related to work, right? Burnout is what happens when chronic workplace stress is not well managed, right? It often presents as fatigue and exhaustion. Those are big components of it, right? And in addition to that, like just physical and mental and emotional fatigue, we also start to see these like negative feelings towards your job, cynicism, mental distance from work, right? That feeling when you wake up, your alarm goes off in the morning, and the first thing in your brain is, ugh, I don't want to go to work today, right? That's burnout. And it's not surprising when we're sort of stuck in this chronic loop of feeling stressed, of feeling exhausted, of feeling cynical and not mentally checked into our work. We're not going to perform as well at work, right? We're going to have a reduced professional efficacy, and that is going to lead to this feeling of a lack of accomplishment. So, as you could imagine, very quickly, this turns into a very vicious cycle, right? I feel tired, I feel stressed, I feel not supported, I feel exhausted and cynical, and therefore I'm performing not as well at work, and then I'm getting that feedback loop of I'm not doing such a good job, which is probably going to make me feel more stressed and more exhausted, and before you know it, we're fighting an uphill battle that is oftentimes hard to see a way out of, right? So this is not an individual moral failing. It is something that happens. I have personally experienced burnout in my professional career. Wouldn't recommend it. Not very fun. But it is real, right? It is a real occupational phenomenon, and it affects a huge proportion of the workforce. And there's a lot of things that contribute to it, right? The things that kind of lead to this cycle of burnout are things like chronic stress, right? And we know that working at a health center or any healthcare profession is a stressful job, right? Sometimes that's kind of unavoidable, but that chronic, relentless stress, right? Excessive workload, right? Having more on your plate than you could ever reasonably accomplish, right? A lack of autonomy. So when someone feels like they don't have any decision-making power or any control over their work or their workload, right? That can contribute to burnout. Insufficient recognition, right? I think this one surprises people sometimes. We say in a lot of our presentations when we're talking about effective workforce communication, we say like, appreciation goes a really long way, right? And it's not like a fluffy nice to have of like, oh, everybody feels nice when they get a compliment, right? It's actually much deeper than that. Because if you are putting your heart and soul into your work every single day, and you have a pile that never gets any smaller, and you keep giving it your all and giving it your all, and you never once hear, you're doing a really great job, we appreciate what you're doing, that takes a toll, right? And it causes burnout, right? And so in addition to that level of recognition is sort of this overall inadequate support, right? If we are kind of floating out on an island on our own without the resources, the information, the support that we need to do our jobs, again, we're going to start to see that uphill battle and that negative cycle, right? So again, this is not an individual failing that somebody just like didn't have the mental fortitude to overcome the burnout and they're weak and they couldn't handle it and so they burnt out, right? That is very much not what we are talking about here. It is a workplace and a systems phenomenon. And in order to combat burnout, we really need to look at our organizations, right? Not the individuals. Organizational change is what's needed to combat burnout. Burnout doesn't happen overnight, obviously. It sort of develops over time. And this nice little infographic here kind of like outlines all of the different stages of burnout, right? Because it's not, you don't go from like, I'm doing great, I'm super engaged, I love my job, till next week oh my goodness, I'm so burnt out and exhausted, I have to leave, right? We really see this progress. We start with a healthy, motivated, and engaged employee. Maybe they have too many things on their plate. Maybe they're not getting enough support to do their job and they become exhausted, right? That exhaustion is going to have an effect on their ability to show up at work. And so from there, we start to see things build, right? When I'm exhausted and I'm not really doing my best work, I'm probably going to start to experience some feelings of shame and doubting myself, right? Why can't I handle this? Why do I feel like I'm never making my to-do list any shorter, right? And feelings of guilt. Why is this so exhausting for me, right? Maybe I just don't have what it takes, right? And then eventually we see that shame and that doubt and that guilt sort of progress even further. And it really takes us to this point of cynicism and callousness, right? Why should I care about this organization that, they've never given me what I needed to feel secure in my job, right? Why should I keep overextending and giving so much of myself when I never get anything in return, right? Thoughts like that are very cynical, they're very callous. And as you could imagine, once we've reached this stage of cynicism and callousness, there's no doubt that that is going to start to affect your work, right? It's probably already affected your work when we hit the exhaustion stage. But certainly when we get all the way to cynicism and callousness, we're going to start to see that manifest in patient interactions, in other, coworker interactions, in really just the way that someone is showing up, right? And if there's no intervention and we don't recognize these signs of burnout, we're going to keep continuing to progress. And eventually we are going to hit a point of crisis, right? I wish I could go back and tell my younger self this so that I could recognize the signs as they were building and have noticed it when I first started feeling exhausted around work. But unfortunately, I didn't have this information or resources at the time. This was kind of like a much younger version of me, and I reached that crisis point. And I can tell you, I went through every single one of these stages before I reached there. And at crisis stage, my mental health was so poor. My workplace relationships were so poor. I felt anxious before every interaction that I had to have with someone. And eventually it took too big of a toll and I had to make a choice to like leave the organization because I just was not well any longer, right? And so I can tell you that this is true because I have experienced it. And I've also talked to countless other individuals who have as well. But there are things that we can do, right, to address this idea of burnout. And this is one model that I think kind of helps lay this out visually, right? That if we are in a position where our job demands are just so extreme, right, that we are seeing more demand than we are support, that is going to lead to distress, right? And that distress is going to lead to burnout. And when we feel burnt out, we're going to see those negative outcomes. And the negative outcomes are going to affect our health, which is going to make us feel burnt out, right? And you can see it will kind of like keep passing back and forth, and we'll see an overall decline in someone's health, and not just their mental and emotional health, but their physical health as well, right? Whereas if we look at sort of the bottom layer of this graphic here, we can see when jobs are well resourced, when the resources sort of outweigh the demands, that's when we start to see motivation, right? I am motivated to do my job. I am more engaged in my job. And when you're more engaged, you see more positive outcomes. And that again becomes a feedback loop. So those positive outcomes contribute to more motivation, which is going to contribute to more engagement, right? And you can see sort of these crisscrossing arrows at the beginning of this graphic here, where we see if we have those job resources, um, you know, the support will kind of lead us up to this place of distress. And if we have too much job demands and experience eustress, then that could potentially lead us to a place of motivation, right? So we are not stuck in these paradigms, but there is something going on here, and it's not just in one direction, right? And so this is where we want to focus our attention, to really considering thoughtfully this balance between job demands and job resources, right? Because again, we're going to see a lasting effect. So when we're thinking about combating burnout, what we're really thinking about is investing in well-being, right? The more well-being your employees have, the less burnout you're going to see, right? And these are some of the guiding principles to really keep in mind when you're thinking about how to best support employee well-being, right? First and foremost is safety. This is both physical safety, emotional safety, and mental safety, right? We're also talking about things like trustworthiness and transparency. When there is a lack of trust and a lack of transparency within your organization, it will have a negative effect on your employees' well-being, right? Another sort of kind of guiding principle, really something that's really going to contribute to that sense of well-being or not, is your colleague support, right? What does that community of colleagues look like within your organization, and how are they given opportunities to support one another? What is that organizational culture like for your employees? And kind of related to that is this idea of collaboration and mutuality, right? Do people feel like they have a voice within your organization? Do they feel like they have the opportunity to work well with others, right? And have their voice be heard? So these are some things to keep in mind to really ground yourself in this concept of well-being, right? And something else that we talk about at the STAR Center here when we're looking at workforce well-being, we like to look at this through the lens of 4 pillars. These are the key pillars of wellness. And a lot of times we think about well-being as being this like one fluffy, nebulous idea, and it's really not. It's really kind of broken down into all these different layers. So when we think about well-being, we can think about physical well-being, we can think about emotional well-being, we can think about financial well-being, and we can also think about communication well-being, right? And none of these 4 exist within a silo. They all interplay with one another, but they are all really important for us to pay attention to, right? And there are things that we can do within our organizations to support each of these pillars of wellness individually, right? So let's start with the physical and just thinking about that. Things we can do to support our employees' physical wellness. Those are things like leaning into your EAP programs or any kind of additional benefits that you're able to offer your staff, whether that's a discounted gym membership or reimbursement for any kind of physical exercise activities that they're involved in, right? And we can also think about this in terms of the physical space within your organization, right? Do people have an opportunity to get up and walk around and move their bodies throughout the day? Right? How can we get creative about creating those types of opportunities, right? Maybe have a step counting challenge or, a chair yoga move of the week that everybody gets in the newsletter and has to try at their desk, right? There are all kinds of little ways that we can start to implement changes to better support each of these pillars of wellness, right? Things within your compensation and benefits package may support someone's physical well-being. Things within the physical layout of your workspace can support someone's physical well-being. Even just the culture of encouraging people to move, right? Maybe if you cater lunch once a quarter or once a month for your staff, how can we think about incorporating more healthy options for people to support their physical well-being, right? Again, the idea here is that we are looking at our employees as whole people, right? And whole people have all of these different kind of levels to their wellness, right? Emotional wellness, right? That we invest in that through things like recognition and support for our employees, right? Making sure that they're aware of all the resources that are available to support their mental and emotional health, right? Whether that's through your benefits offerings, your EAP, what have you, right? When we look at financial wellness, there's a lot that's within your power to do there. And I know oftentimes it feels like there's not, because budgets are budgets, and sometimes there's not additional, funds to play around with for people's salaries. But there's other ways that we can support people's financial well-being, right? Beyond just what we're offering as their base salary. We can look at compensation, as my colleague Michelle talked about in the session last time, in a more holistic way, right? And think about other opportunities to support someone's financial well-being. And then lastly, communication. I think this is the one that is the least obvious to people. When we think about well-being, it's sort of obvious, okay, physical well-being, emotional well-being. Yeah, I need money to pay the bills. That's part of my well-being. But communication wellness within the organization is so, so important. It's something that I am personally very passionate about. And when we have, organizational norms and policies and spaces that support effective workforce communication, you're going to see increased well-being of your staff, right? Think of a time where you were working a job and you did not have access to the information that you needed to successfully do your job, right? I'm sure that's happened to everybody at some point. I know it's happened to me plenty in my career, right? It's a very frustrating feeling, right? And it very quickly translates to feelings of disengagement, right? Of why should I care about investing so much of myself in this organization when nobody's even telling me what's going on, right? Why should I respect the organization or people in leadership when it's clear that they don't respect me, right? And I'm not saying that's like a right way to think, but that is how people think, right? When there's that lack of wellness around communication and that lack of intentionality around how information is flowing and how people are accessed within the organization, it leads to increased stress. And we know that that increased stress is going to lead to burnout. So what are we going to do about it, right? I kind of just rattled off quickly some ad hoc ideas for how to support well-being. We've got a lot more of them at the STAR Center if you're interested in going deeper. I'd actually love to hear from all of you. So if you can take a moment and write in the chat, what is something that your organization, either past or present, has done to support workforce well-being that you have found to be really successful? What's something that's worked well for you to support well-being? There are no right or wrong answers, but let's pop some ideas into the chat and see what you all have been up to. Could be either a policy you implemented, or it could be a policy you participated in as a staff member. What is something that you've seen an organization do that has supported your well-being or your employees' well-being? And if you're not comfortable sharing, you can send the message directly to the hosts and panelists, and I can read it out for you. An employee retreat, thank you. That's great. That's like a beautiful way to build in time and space to really pay attention to well-being and enhance that communication, right? When we all have the opportunity to really spend time together. Regular staff meetings with an agenda and open discussion. Thank you, Janet. That sounds like a great plan, right? And again, that might seem like something so small and obvious as a part of your organizational kind of just operations, but really what that's supporting is communication and emotional well-being, right? Because we are giving people the opportunity to both receive information and contribute information, but then also participate in the organizational culture by having that open discussion, right? Let's see, brought in someone for financial advice during an economic hard time. Fantastic. Thank you, Brianna. That is a really great way to invest in the financial well-being of your workforce, right? So you might not have the resources at your disposal to give everybody a 10% raise this year on their salary, but maybe you do have the budget to bring in a speaker for an hour and help better educate people about managing their own finances, right? I think we all know when we are feeling financially stressed and not well, it has an effect on every single area of our life, right? And especially, in this space, people may need to seek other opportunities if they are feeling burnt out in all of these domains and they're not able to make ends meet, right? Let's see what else we got here. The workforce team provides recognition and appreciation via monthly snacks and a written thank you. Amazing. Snacks are an incredible tool. You need to get people to a training. offer them free snacks, right? You want people to feel appreciated and recognized, give them a snack. It sounds silly, but really we're all just big toddlers and it works. It's a really great way to keep people engaged. And like something so small of just like a little post-it that says like, you did great today with like a Snickers bar, like what did that cost you? $1.30 of your time. It made somebody else's day, right? And that's really going to help keep them engaged and well in the workplace. Let's see, scheduled weekly check-ins with the supervisor. Doesn't even have an agenda, just an open space to share what my workload looks like and how I'm doing. Fantastic. I love that idea, right? Again, this is the idea of really like investing in codified systems and channels to support that communication well-being, right? Because I bet you if you were struggling with something and having a hard time, it would be a lot easier to bring that up with your supervisor if you have that set space and that rapport, right? As opposed to having to go to them and say, I need to talk to you and create a new space to do that, right? I actually had a similar experience at a job. I was during the pandemic. I was not at ACU, it was a different organization. I was really struggling, and I set up. I was working very closely with the executive director, and we started having daily check-ins in the morning because that's what I needed for my emotional wellness. Because I was alone in a one-bedroom apartment, losing my mind. So I needed that connection to stay grounded in the work, to make sure things were moving really quickly, make sure I was up to speed, and have that emotional and communication wellness of having that space to connect, right? So I think that's great. Another half day of PTO next year, amazing. That might sound small, but I promise that is not small to your employees. Any little wiggle room we can find to do that is going to support people's mental and emotional health, right? An employee fall baking competition. I love that. I'm a big fan of the Great British Baking Show, so that's amazing. But something like that that's like so fun, right? That we can just invest a couple hours of our time in creating this type of space for people to not just be robots, outputting work, but really have an opportunity to connect with each other, to connect with the community that you're serving, to reconnect to the mission behind all of the work that you're doing, right? These are fantastic. Thank you all for sharing. I'm sure there's other great things that are going on out there. So please, if something pops into your head, please put it in the chat. There are so many things that we can do and so many things we can learn from one another. And they don't necessarily need to be costly, and they don't necessarily need to be incredibly time consuming either, right? I'm thinking of just a few other examples I've heard from health centers over the years. One of them had like an extra, kind of like a little storage room on their site that wasn't really being used for anything. And so they kind of revamped it and made it like just a quiet corner room for their staff, so that if someone was having a really stressful day or maybe had a really difficult patient interaction, was just feeling overwhelmed, they had a safe, quiet space to just go and like close the door and sit. And they had like fidget toys in there and comfy chairs and cold water. And so something like that, like, doesn't necessarily have to be a huge investment. You don't need to build a new wellness spa wing for your staff, but just creating a physical space like that for people to go to decompress for a minute can have a huge impact, right? Offering things like training and education around mental health, around physical health, around financial health, right? All of these things really work to support our staff. So there's a lot that we can do. There's a lot, it sounds like you guys are already doing. But when we're thinking about doing this, what we would really encourage you to do, yes, sometimes we need to try things here and there, but what we're really thinking about is building an organizational well-being plan, right? And this is where we circle back to that idea of a comprehensive workforce plan, right? This organizational well-being plan is a part of your retention strategy, right? And so write it down. It is critical for organizations to develop a well-being plan, and one that addresses the needs of all of your staff, right? Think about who you might be forgetting, who you might be leaving out, and talk to that person first, right? The plan should focus on organizational change that mitigates workplace stressors and promotes employee wellness, right? And the only really way to do this in a way that's effective is to hear from your staff about what is going to be meaningful to them, right? And support their well-being. And so this is where we enter this idea of human-centered design as you're designing your well-being program or your well-being plan, right? Again, write it down. But we start from this sort of phase of inspiration, right? How do we better understand people and engage them in the process? You need to hear from people first so that you can try things that might actually meet their needs, right? And then you sort of move to the ideation phase. From the inspiration, you start generating ideas, you test them, you identify opportunities for growth, you refine your solutions, right? And then we can move to the implementation, right? Make the design available, maximize its impact. And you might notice that the arrows on this graphic go in both directions because this is not a one-directional linear process, right? You need to kind of constantly be in a loop here of going back to the inspiration of making sure that this is serving the people that we are aiming for it to serve, to then brainstorming, to then trying things, to then collecting feedback to see how it is going, right? It's a real missed opportunity if you design a plan to support the well-being of your staff without first hearing from your staff what they need to support their well-being, right? And so again, this is just another, kind of sequence to keep in mind as you're thinking about building your organizational well-being plan, right? First and foremost, securing that leadership buy-in. As we were discussing earlier, having buy-in from leadership and having leadership sort of model what you wish to see here can be a really powerful sort of change agent within your organization. So before, instead of coming up with a whole great plan and then running it up the food chain to have somebody in leadership say, I'm sorry, we can't do this, right? That's going to be a big waste of time. So first, let's start with that. Let's start with securing that leadership commitment and support to make sure we have the organizational investment in what we're trying to do here. Right. And then we move into this human-centered design phase, right? Where we're gathering staff feedback on their experience and on their needs, right? So if you ask your staff what they need, right? If you were to, let's say, just take my idea that I just shared, it's not my idea, but take an idea that I just shared and say, we're going to build like a quiet, cozy room, in the office, you may do that. And then your staff say like, we don't want that. That doesn't help us, right? Like what I need is for you to hire another coordinator so that I don't have 75 caseloads on my desk every morning, right? So really try to understand their experience and their needs and what is going to move the needle for them in terms of their own well-being, right? And then this is another pitfall I see people fall into a lot is they sort of they're doing great, they got the leadership buy-in, they've asked people for their staff, and then this is where they get stuck ideating, right? They come up with ideas, they put together proposals, they brainstorm, what about this, what about that, and they never actually do anything, right? And eventually you're gonna need to implement a change, and I can't promise you that it's gonna go over perfectly, but you need to try something in order to learn and evaluate and make sure that you're hitting the mark, right? So you got to try something, implement an organizational change, right? But don't just stop there, right? Continue to measure, continue to update, continue to make changes, right? And really make sure there's a feedback loop there so that when we're trying things, we can understand if they're working or not, tweak the plan and try something different, right? So again, this is not like a one-time, I'm going to come up with a plan, poof, now everybody is well, right? And everybody has well-being, right? We really need to think about this in a strategic and intentional way. And remember what's at stake here, right? Turnover is incredibly expensive, right? And there's sort of like this direct chain that we can follow, right? Of people experiencing a lack of well-being at work are going to start to experience burnout at work. And when they experience burnout for a prolonged period of time, they are going to leave. And that's when you see turnover, right? You see increased turnover, decreased retention, right? And then what do you have to do? You have to go back to the recruitment phase and start bringing people in. And it starts to feel like a revolving door. And it's a huge, huge sort of investment of time and energy and resources to be constantly rehiring for the same positions over and over again. And so the goal for all of us, right, is to keep our turnover rates low, our retention rates high. And one of the most important things that we can do to invest in that high retention rate is to really be strategic about investing in workforce well-being, right? If you're wondering just how expensive turnover is, I think we all understand that like not only is it stressful and time consuming to have to be constantly hiring, but it is also quite costly. And if you would like to know exactly how much it's costing you, I encourage you to check out our financial assessment for provider turnover tool. You can input some information and you will get a literal number back of how much this is costing you. But if you are in a position of leadership or you have the ear of leadership, this is what we really like encourage you to ask yourselves, right? what is the actual cost of turnover, right? Both in tangible dollars and in intangible morale and time and energy, right? What is the cost of having a provider vacancy? What is the cost of recruiting someone for a vacant position? How much money are we losing overall to these workforce issues, right? If you start to think about how much money you're losing from turnover, the thought of investing like a couple $100 in a pizza party for your staff once a month starts to sound like a little bit less intimidating, right? If we can really think about the investment of our finances in that way, right? Again, how can we better invest our money to retain our staff and minimize our losses? Okay. I would like to hear from you all. I know you all shared some things that have been working well for you, and I love that. But I want to know what your biggest challenges are. What are your biggest challenges around workforce well-being? I'd like to go back to this slide on the 4 pillars because I really want to make sure we have our eye on this whole picture. But what has been most difficult for you all at your organizations as you're trying to think about improving your workforce well-being? What are the biggest barriers you face? What are the most persistent challenges you see? Pop it in the chat. Let's do some brainstorming together. What are your biggest challenges when it comes to investing in workforce well-being? Yep, would like to offer more or better benefits, but there are financial restrictions. That is so real. We hear that all the time, right? You are not alone in that. Your health center is a division of the health department, which creates a barrier for competitive salaries. Yeah. hmm That is also very real, right? Listen, we are realistic. We understand that your budgets are finite, right? And like sometimes we can't make more money appear. But there are things that we can do that don't cost anything, right? Communication, right? If a manager is burnt out, then they're not able to provide that communication for their employees. And managers aren't always the first to say when they're struggling. Thank you, Brianna. I think that's a really important insight, right? Because we talk a lot about this idea of leadership and making sure we have that buy-in from the top. But when I talk about leadership, I'm also talking about managers. Managers are also in a leadership position. They're sort of kind of sandwiched in the middle. They may not have all of the decision-making power, but they are certainly in a leadership role and have an opportunity to have an effect on the employees that they are managing, right? And so really thinking about everyone, top to bottom, right? Not just how are we investing in the well-being of our senior leadership or how are we investing in the well-being of our janitorial staff. I want you to think about everybody in between, right? And the thing to pay attention to here is that different teams and different levels within your organization might have different needs, right? So the support that those managers might need to combat their burnout might be different than what's a provider needs to combat their burnout, right? And so it's important to not get too narrow-minded about like a one-size-fits-all approach to thinking about investing in well-being and really do things that are going to meet people where they are and meet their needs, right? So I think, Brianna, that's a really like important point, right? That managers really kind of like hold the key to a lot of it, right? And if they're burnt out, it's going to have an effect both up and down, right? And I think there's another really important point in here as well, is that when someone is burnt out, just naturally their ability to communicate effectively becomes decreased, right? And so if you're burnt out, you're likely less engaged at work. You kind of are probably just trying to keep your head above water and make it through the day. And so you're not going to be showing up for your colleagues or communicating with them in the best way you can, right? So I think that's really important. What else? What else is feeling like a barrier to you all for addressing well-being within your workplaces? I think something else to keep in mind as we're, thinking about crafting a well-being plan and really like writing it down. And as we're in that phase of trying to understand what the barriers are for our staff, is really getting curious about that, because it might not be what you think it is, right? You might be assuming that like people don't have well-being because they're not getting paid as high a salary as they want. Sure, that might be a part of it, but what they are really needing or wanting, or what's actually going to move the needle for them around feeling burnt out, might be something completely different that you hadn't thought about, right? It might just be that their office is on this side of the building and the restrooms are all the way over here on this side of the building. And so every time they need to take a bathroom break, it takes up 10 or 15 minutes of their day to walk to the other side, right? That might seem small, but that's going to have a huge effect on that person's daily experience at work. And so if that's the case, maybe we can just move them to a different desk that's closer to the restrooms, right? Because they have a very time sensitive role within the organization, right? You might not be able to build a whole new bathroom, right? Over by their desk, but maybe we can think about flexing their schedule in a different way, right? Or moving their desk somewhere else, right? And that's just one example, right? But there are a lot of things that we can do without spending a single penny, right? I think a lot of times when we think about investing in well-being, we think about throwing money at the problem, right? Well, we'll just offers everybody a stipend to get a gym membership so that they have better physical well-being, right? Or, we'll give everybody a year-end bonus so they're a little bit financially secure, right? Money doesn't solve every problem. Sometimes it's as simple as, we already have a monthly staff meeting and now we're going to start reserving 10 minutes of the agenda at the end for open discussion, right? That costs you $0 to do that, right? Maybe we have a newsletter that goes out to the board of directors once a quarter. Maybe we start sharing that with the rest of our staff as well. So we're increasing our communication well-being so people feel more in the loop and more plugged into the organization. Again, that costs you $0 and is going to have a big impact on someone, right? Maybe if we're thinking about investing in emotional well-being, people have really stressful, overwhelming jobs, right? We're not necessarily going to change what it's like to have a stressful patient interaction. But maybe we can offer training opportunities and maybe we can leverage in-house expertise so we don't even have to pay an external trainer to come give a training for the rest of staff on, better, nonviolent communication techniques or whatever it may be, right? That's going to help somebody in their role to feel a little bit less stressed out about it. There are a lot of things that we can do. And again, it's important to try things, but it is important to write them down as well. All right, we are nearing the end of the road here. I'm going to pause here. Does anybody have any questions? What's on your mind? Questions about investing in well-being? Questions about really codifying this as a part of your workforce plan or your retention strategy? All right. We encourage you all to stay in touch with us. Please subscribe to our newsletter that will keep you up to date on all of our webinars, our training opportunities, our publications. We spotlight some resources for you to check out. It's a really great way to stay in the know. So please keep that there. In just a moment, you should have an evaluation popping up on your screen. We really appreciate your feedback. We'd love to hear from you. And as a reminder, this is session 2 of a 3-part series. So if you are registered for today, you are already registered for part 3. It's going to be 2 weeks from today, same time, same place. And we're going to be talking about investing in career pathways and skill and career development, again, as a part of your overall retention and comprehensive workforce planning strategy. So I'd like to thank you all so much for joining us here today. We encourage you to stay in touch if you have any follow-up questions or anything comes up that we can help support you with. Please feel free to reach out, drop us a line. We are always happy to hear from you.